So I'm currently working as a research associate at the National University of Ireland Galway with my supervisor, Dr. Kieran Sarma. And we're also working in collaboration with the Royal National Lifeboat Institute, or the RNLI, based in the UK, and also Irish Water Safety, who are the statutory body established to promote water safety in the Republic of Ireland. They're also based in Galway as well. And what I'm going to be presenting on today is an overview of a project that we've been working on for just coming up to a year and a half now, to develop a national drowning fatalities database as an evidence base for intervention design in the Republic of Ireland. So a little more specifically, I'll talk a bit about the project background and aims. I'll then go on to discuss sort of current data availability for drowning fatalities in the Republic of Ireland at present. I'll talk through the process of designing a data taxonomy for this new database, touch on the topic of database design, which is still in progress, and then outline some of the next sort of planned steps for the research project work. So, as we've heard over the past 2 days, here on the island of Ireland, we're particularly lucky in that we're host to some exceptionally beautiful bodies of water, or at least we like to think so. And they're the home of the array of water sports and activities engaged in by the Irish people. They represent a large source of tourist income and income for our fishing industry. But of course, due to a number of factors, just over 130 drowning fatalities occur along these every year, the majority of which are preventable and costly deaths. So just to provide you with some brief summary statistics provided to us by the Central Statistics Office, across the past decade, an average of 132 people have drowned each year in the Republic of Ireland. So the majority of these have been classified as accidental deaths at 43%, followed by drownings by suicide at 36%, relatively few drownings by assault or homicide, and 21% undetermined, where the cause couldn't be definitively coded. Now, I think something potentially important to note here with regard to drowning fatalities data in general is that it is likely that there are a greater number of suicides here. There may just have been insufficient information to definitively rule on this. In addition, and I think this was something that John touched on in his presentation yesterday morning, historically in the Republic of Ireland, deaths by suicide have tended to be underreported in general, and so we imagine that this could carry over to this sector too. So it's just something to bear in mind as we go through this. So the question then is, how can we build on the excellent work already being undertaken in this country to reduce these drowning fatalities? So as with any behavioural or health-related intervention, the efficacy of the work of prevention and response services does depend on the extent to which they can engage in evidence-based practice. So as we know, an evidence base on drowning needs to identify high-risk populations and their characteristics, where incidents occur, the nature of hazards present, rescue and recovery response, and event characteristics, really at a minimum. And this can be typically presented in the form of a risk assessment to inform targeted successful interventions. But of course, the value of any risk assessment is contingent on the quality of the data available to inform it. So it needs to be accurate, needs to be consistently recorded, sufficiently detailed to allow interpretation, and sufficiently broad to provide scope of the full risk picture. So back in 2014, the RNLI, Irish Water Safety, and NUI Galway collaborated on a report assessing the potential to carry out high-quality quantitative risk assessments in the Republic of Ireland with current drowning fatalities data. So one of the main conclusions of the report was that in order to facilitate this kind of high-quality risk assessment in future, we would need a centralised national drowning fatalities database in order to do this, to coordinate and synthesise the sort of different pockets of drowning fatalities data that exist in Ireland at present, so that we would have a sort of core overarching evidence base to inform intervention design. So this database would need to be retrospectively completed, and in doing so, the availability and reliability of this data could also be assessed. And also we could potentially identify means of enhancing or supplementing this if deemed necessary. And then we'd also like to look at a data collection process for real-time data collection, so just for drowning fatalities as they occur, to ensure that we have an up-to-date database. So I think Sarah introduced the team earlier. I'll just put the photo up again for anyone who wasn't here. there's myself there. So yeah, she's introduced the team already, but I do quite like this photo. It was taken, I think, right after I got the job, so you can see that I'm beaming ear to ear. So it's nice to reflect on that. So moving on, so these are the overall core aims driving the current project. So we wanted to first assess drowning fatality data records in Ireland to see what data is currently available to Irish Water Safety and to the project team. We then wanted to try and improve the coverage, scope, and most importantly, I think, quality of drowning fatalities data recorded in the Republic of Ireland. And then last, and I suppose ultimately, we wanted to produce, to provide this sustainable, centralised fatalities database for Ireland to house this data for use by stakeholders and be maintained by the research team to support and inform intervention work. So based on those core aims then, the following sort of key work packages or tasks were identified as necessary to achieve these. So first of all, we wanted to conduct a scoping exercise just to determine the current levels of data availability to Ireland and identify means of enhancing this. We then wanted to develop a novel drowning fatality data taxonomy for the database, so just to specify exactly what data that we wanted and to evaluate this according to stakeholder needs. And then this would go on to inform the design of the database, again, doing so in light of the needs of our various stakeholder groups here. So, first of all, I suppose a little bit about Irish Water Safety. So they are the statutory body established to promote water safety in the Republic of Ireland. So amongst, I suppose, a range of other duties, they set standards for, train and assess Irish lifeguards. They deliver swimming, life-saving and awareness training to citizens and organisations, including public awareness campaigns and various publications. Now, in terms of the fatalities data that Irish Water Safety receives, so they receive an annual data return from the Central Statistics Office, which is a relatively simple sort of frequency data file, essentially. So just detailing the number of fatalities that occurred that year, giving some sort of an age and gender breakdown, and I think identifying what county it occurred in. They then receive their more detailed data from the C67 forms that Sarah mentioned in her presentation. So this is essentially a one-page official report document that's received by Irish Water Safety from a Garda investigating a drowning incident. And these are returned to the Irish Water Safety offices as required by law. So the C67 forms, I mean, they do detail the same information as is provided in the CSO, the Central Statistics Office return, but they also provide additional info. So, for example, the date of death, they'll include victim characteristics. They'll also outline information regarding the cause of death, the individual's swimming ability, though I think they measure it as good, poor, or none, which might be quite controversial in this room at the moment. But they also record things such as the type of location where it occurred, whether resuscitation was applied, and the guard's opinion as to how it could have been avoided. So there's some interesting data there. So data from each of these forms is then entered into Irish Water Safety's personal database. It's called the Data for Heroes, or D4H database. So when it came to the scoping exercise, basically we examined all of the C67 forms returned to Irish Water Safety of fatal drownings that occurred during the period of 2012 to 2013. And then we compared the number of incidents documented by those with the sort of official statistics from the Central Statistics Office for those 2 years. We also looked at the level of detail provided on the forms and examined whether this varied somewhat from form to form as different people filled it out. So what did we find? Well, across the 2 years, C67 data covered just 38% of the drowning fatalities that occurred, which is, of course, relatively low. From dealing with these forms, it also did become quite apparent that the level of detail provided by these did vary quite a lot. So, for example, one of the questions on the form asks for the officer to outline the circumstances surrounding the incident. So responses to this did vary quite a bit. Someone might just write the word drowning incident, for example, or someone might detail how an individual was out with friends fishing in the open sea and was observed to fall in. So it did vary. Now this, I think, likely relates to the nature of the form itself, which doesn't actually specify how much information is required here, but either way, it was a concerning finding. So, of course, it wouldn't really be advised to conduct a risk assessment on data that has less than 50% of the coverage of incidents that occurred during those years. So at this stage, it really did become apparent that if we wanted to proceed and create this national drowning fatalities database, we really would have to look for ways to augment and supplement the data that's currently available and establish a protocol for doing this. So you've heard quite a bit about that from Sarah's presentation. It's something that I'll come back to in a couple of slides throughout this one. So I suppose moving on then, and after identifying the need to enhance data records, including the quality of the information that's currently being recorded, we turn to the development of a data taxonomy for our soon-to-be National Drowning Fatalities database. So when I talk about a data taxonomy, just this basically refers to a hierarchical means of categorizing and recording drowning fatalities data, where each broad category comprises a series of subcategories, and then those are comprised of different elements or items for selection. So just to give an example for that, so a broad category in the taxonomy would be victim demographic information, a subcategory would then be occupation, and there'd be a definitive set list of options to select there for the person working in the database, so a student, for example, and so on. So when it comes to creating data taxonomies, there's no definitive guide that exists, or we haven't found it anyway, it's not for want of trying. So you're kind of working with more general guidelines. So a context-specific approach is really what's needed here, and so that's what we adopted. So first of all, we decided to access and review as many existing global drowning data taxonomies as possible and learn and really draw from these ones. Second, we wanted to identify the data needs of our core stakeholder groups here in Ireland to ensure that any information we were gathering would be relevant and recorded in a way that would be useful to them. And third, we draft the taxonomy, evaluate this with a stakeholder workshop, and we then incorporate this feedback to create the final definitive set. So how did we do this? Well, first of all, we contacted every member group of the International Life-Saving Federation with requests for any data taxonomies that they're currently using or any that they were aware of, that they might be able to provide us with some information on that. We also identified and contacted some additional drowning prevention groups who potentially had access to taxonomies. I suppose we also turned to the broader research literature on taxonomy design and research papers on drowning specifically to identify the key information commonly used in risk assessments and to build risk models in the drowning sector, or water safety sector rather. So we received a very wide range of responses from groups in Singapore to Brazil to Denmark, and eventually we decided to run a comparison study of a selection of some of the, I suppose, more relevant and similarly detailed taxonomies we received. So we focused in on ones from New Zealand, Canada, the UK, and the Irish Data for Heroes database taxonomy. So this study, it highlighted, I suppose, categories of mutual importance across the four, which was excellent, and so we ensured to include those in our final taxonomy, as well as often identifying unique ways of thinking about fatalities data and showing us different ways in which we could record the information. So essentially we included as much of this as we could. We wanted to have a really inclusive taxonomy while still ensuring that it was sensitive to the Irish context. So we then recruited a range of expert Irish stakeholders in the area of water safety to evaluate our proposed data taxonomy during a one-day workshop on the NUI Galway campus. So you might see a few familiar faces in the picture there. So we had representatives from Irish Water Safety, we had water safety officers, Central Statistics Office, An Garda Síochána, the Health Service Executive, Irish Coast Guard, Health and Safety Authority, and of course the Life Saving Foundation. And I suppose the purpose of this workshop was really to first just ensure that the taxonomies would capture data that was relevant to their work and that we were conceptualizing the categories and subcategories and any elements included in a way that was correct and accurate and would be helpful for them. And second, we wanted to make sure that, well, there actually would be a way to provide the information that we were looking for. So we wanted to see whether it could potentially be provided by some of the services who were present at the day. And we ran interactive management sessions to do this. So interactive management, it's a method of facilitation that helps groups, typically groups comprised of experts, to think, plan, and act collectively in response to a complex situation or problem. So we adopted the nominal group technique and idea writing for the purpose of our workshop. So this essentially just involved our trained facilitator splitting the groups into, splitting our total sample of experts into specific groups and then giving them sections in the taxonomy to review. So they were then prompted to individually write suggestions for improvement that would then feed back to their small group, to the larger group, and open up for a broader discussion. And this was just done in a very specific, structured, and guided way using targeted prompts, for example. And then for the last session of the day, we just focused on a more sort of general discussion of data needs and data usage, which also involved the administration of a survey, again, just checking to see whether the different groups present might be able to provide some of the data that we were looking for, and that would be recorded by the taxonomy. So the sessions were all recorded and painstakingly transcribed, and we came away, though, with an absolute wealth of data. It couldn't have been more successful. It was fantastic. So I think just some nice examples here. I think it might have been yourself, John, Brendan, and I think possibly Patrick Book, who talked about the sort of the dynamic process of drowning and how our initial approach of recording a static location point for this really didn't capture that important information. And so we've now incorporated that into the taxonomy, and we look at entry and exit points as we go through that. So we were also advised to adopt the Irish census model in recording demographics information, as this would facilitate us comparing our data with the national population, which is an excellent idea. Annoyed that I didn't think of it myself, but really, really helpful feedback for that. So the penultimate draft is now complete. It's going to be sent out for one final, hopefully final review from the stakeholders in the coming weeks, which is very exciting. But it means that unfortunately I can't present on them in too much detail today. Also, I suppose just to note that very promisingly, the findings from our data survey that we administered during the workshop suggested that there's scope to collect the vast majority of the information that we would be looking for in the taxonomy itself. So that was very, very promising. Okay. So now that the taxonomy is very close to being completed, we're turning to the actual design of the database, which we're very much in the initial stages of. We're currently consulting with staff and research students at the university in the School of Engineering and Informatics at NUIG to see their ideas, what they could potentially bring to the project, were they to be involved in designing the database. The School of Psychology has also contracted a number of different companies to work on similar projects in the past, so we might consult with them as well at some point. I suppose the exact layout of the database will be contingent on the person that we do eventually recruit. It'll be partly their vision as well as ours. But we do have certain features in mind for this. So we're very interested in geospatial incident mapping. Really want to have enhanced functionality to select and extract, or export rather, specific data sets. I think that'd be quite nice. And just means of generating nice figures and tables for reports are some examples for these. I think our main focus is just that it should be as user-friendly as possible, so that it can be used for stakeholders to inform design. So in order to ensure this, to achieve this, we're planning to hold at least one more stakeholder workshop to evaluate and provide feedback on a number of different database prototypes before finalising the design that we go with. So these will likely be held in early 2017. And then I think once the database is up and running, and it's hard to say exactly when that will be, we're hoping by the end of next year, we'll also be holding a series of stakeholder workshops on evidence-based behaviour change and intervention design, and how to optimally use the data that will be provided by the dataset to change behaviour using psychological principles and theory. So one of our goals is, as I said, to make the data as user-friendly and as accessible as possible to drowning prevention and response services. But we will have to still ensure that we do meet, of course, data protection, data sharing, and ethical standards. So we'll be providing tiered access to any interested parties. So I suppose, for example, members of the RNLI, the Coast Guard, they'll have far greater data accessibility than members of the media or members of the public. So again, now that the taxonomies are nearly completed, we're aiming next, so the next big push is to perform essentially a test run of these by creating a retrospective data set of Irish drowning fatalities for a 5-year period from 2010 to 2014. So we're going to do this using the same sort of coordinated cross-checking processes and approach as used in creating the data set for the coastal drowning fatalities. So that is supplementing C67 data with RNLI return of service forms, potentially with media reports from Counter Media. In addition, we're now also in communication with the Irish Coast Guard, who will hopefully be able to access some of their data from. We're working with An Garda Síochána. We will hopefully be getting access to their pulse records. So these are their digital records of any investigated incidents. And we're also recently granted access to the Irish General Register's Office to all national death certificates or coroner records, which we can digitally search through to identify records relating to drowning, which is fantastic news. We've been waiting for that for quite a while now, so it's very, very promising. So the 2010 to 2014 dataset is likely just going to be housed in a Power BI database for the moment until we have the actual database up and running. So it's all coming together, really, and it's wonderful to see how motivated people are to share data when we've contacted them. It's really great. So we do now need to revisit our retrospective case protocol now that we will be getting data from so many different sources or additional different sources. So just to determine what records should be consulted to first create the case, for example. And we also do need to establish a means of recording real-time drowning data, which we'll be focusing on, I suppose, devising and then piloting in the coming months as well. I think in Ireland, so as compared to other jurisdictions, we do have a relatively lower number of fatalities to work with each year. So, for example, last year 122 occurred, which is one about every 3 days, I suppose it breaks down to. And so maintaining a very up-to-date current data set where a core research team member coordinates return of data from multiple stakeholders, I think really is quite achievable and feasible going forward. And again, as I said, we hope to conduct a series of stakeholder workshops as the database progresses and publish on this process where possible. So to summarize, as I said so far, we demonstrated that there is a need to build upon and synthesize existing drowning fatalities records if we are to populate this new drowning database. We've designed, evaluated, and documented a process of designing a drowning fatalities data taxonomy for this database. And following any final changes, hopefully not too many, we'll be using these to record fatalities data in the future. Again, we're hoping the database itself will be completed within the next year, and we hope to also have that enhanced data set for 2010 to 2014 ready for import as soon as that's done. And yeah, the idea is that this can be used by stakeholders. It'll be used by our research team, certainly, to create releases, reports for publication, and most of all, to inform intervention design. And again, as I said, we're working towards establishing now a real-time data collection process, in addition to refining the process for retrospective case creation, which will hopefully be adopted and used for years to come. Although with the implementation and use of this database, we hope that will be for far fewer drowning fatalities as time goes by. So thank you very much for your attention. Thank you to the Life Saving Foundation and to the Surgeon Admiral Frank Golden Scholarship Fund for granting me the opportunity to speak today, and I'm happy to take any questions.